According to the Oklahoma State Plan on Aging, the number of citizens over the age of 60 in Oklahoma is increasing at a rate 2 to 3 times faster than the general population. And that's making finding quality care in assisted living facilities and nursing homes more difficult to find and more expensive. In this week's in-depth conversation, moderator Reese Wetzel and his guests discuss the challenges facing families and the nursing care industry.
Thank you, Jason. We have a panel of guests that can really inform us on this issue that is plaguing Oklahoma nursing homes. To start off, we have Kimberly Green. She is the Chief Operating Officer for the Deaconess Group. We have Stephen Buck, President and CEO of Care Providers Oklahoma. We have Whitney Bryan, a reporter from Oklahoma Watch. And then we have Mary Brinkley, the Executive Director of Leading Age Oklahoma. Thank you all for being here today.
Thank you.
Thanks for having us.
All right, Stephen, I'm going to start off with you. Tell us about this nursing staff shortage and how is it impacting nursing homes across the state?
The first thing to underscore is this nursing shortage as it relates to long-term care workers is not a recent phenomena. It actually was present prior to the pandemic, but the pandemic has absolutely accelerated it. And especially as we've gone through what has now been 2.5 years of extraordinarily challenging work for our frontline heroes, you're going to have during that period of time, you're going to have burnout, you're going to have sickness among employees. And so we're at the point now that I can honestly say our providers are facing a workforce cliff. And without a long-term solution, we are going to have seniors in desperate need of care who will not be able to access the appropriate level of care.
So Kimberly, I wanted to kind of transition into that. You know, we've seen nursing homes starting to close down across the state. What happens when a nursing home shuts down? Where do the residents go? How is it impacting their lives and everything?
I think we've had over 300 in the country shut down so far. We've had a few in Oklahoma, and when these elderly people are moved from their home to another facility, it's usually hours away because typically the ones that shut down first are the ones in rural areas. And we're also, one of the largest providers in that area. And so that directly impacts that town and that area as well. But these residents, whenever they move within the first year, around 80% of them will pass away. And it's just a huge shock on their system. And it also moves them away from their family members. If the family members are hours away, they don't get those visitors. The staff members typically don't come with them. And it's just an entirely new start. It's a very tragic situation.
Mary, now that we've kind of talked about the process of what's happening when nursing homes shut down, what does it look like to get someone into a nursing home? If you have a loved one that needs to be in a nursing home with all these staffing shortages, is it becoming more difficult? Is that process becoming more expensive and just overall more complicated?
It's all about access. A real eye-opener during this whole process for me was we had a member community in Oklahoma that built a brand new memory care center. It stayed empty because there wasn't enough staff. So even if someone wanted to be admitted to that community, they couldn't take an admission. Another member community that historically had a waiting list, one of the longest waiting lists to get to be in that nursing home, they had 4 wings. Now they only operate 2 of the wings because they don't have enough staff. So what does it take to get someone in? There has to be bed availability. They have to have enough staff to care for that individual. And that's what I'm seeing and hearing is that families choose a nursing home only to find out we can't admit that individual because we don't have enough staff. So that's the reality of all of this. You might select a nursing home that's in close proximity to family, but if they can't admit that individual, they could end up being admitted to a nursing home 50 or 75 miles away.
I would like to jump in there really quick. And Mary, you're absolutely right. I mean, I see that in my own communities where I've had wings shut down, for over a year because I can't get staff in, and you want to deliver that excellent care. So you don't just admit people because you have an open bed. You have to have that excellent care. And so I just wanted to confirm, as an operator, that's something that we see all of the time. And you use agency or you offer bonuses. We've given 2 sets of raises. You do everything you can, pay for college. We're doing everything we can to recruit, and it's just not enough. We just can't compete on the pay scale as we've seen in society. That scale just keeps going up. Well, we do not sell widgets, like Target. We don't sell widgets. We can't sell more hamburgers in order to make more money. It is what it is. We get our reimbursement from state and federal. And if it doesn't change, we can't just keep increasing. And so we're sort of in a tragic spot. It's a bad spot to be in for providers.
Whitney, I know that, we've been talking about the staffing shortage, and I know you pulled some recent data to kind of give us some more insight on that. Can you tell us what you found in doing your research?
So I've been watching the Centers for Medicare and Medicaid Services data. That's who all the nursing homes essentially report to and get funded by at the federal level. So they've been tracking things like COVID, positives from residents and staff, as well as the staffing shortages. And I looked at the most recent report. So from mid-September, 297 nursing homes in Oklahoma reported to the feds. And of those, 77 of those nursing homes reported having a shortage of nurses, just nurses. So that's more than a quarter of those homes are saying, we don't have enough nurses to take care of people. Another 73 reported a shortage of aides. So that's another position they don't have. And of course, of those homes who are reporting, most of them are reporting shortages in multiple areas. So they're not just short on aides, they're not just short on nurses, they're short on front desk workers, cafeteria workers, housekeepers, clinical staff. And across those homes, we're talking about potentially 4,000 or more beds. Now, many of those may not be filled because of these shortages, but potentially 4,000 residents who are not getting the care that they really need because of these shortages. And, we have to remember, COVID is still a factor. I know that, outside the walls of these homes, people are typically going about life, as normal, maybe getting a vaccine and a booster occasionally. But, in that 1 week of September 18th, there were 74 residents in the state of Oklahoma who had active COVID, and another 99 staff at those facilities who also had active COVID. So we still have people who are sick, who can't come to work, or residents who are sick, who then require more care than if they didn't have COVID. So you just have that factor that's compounding all of these complications inside these facilities.
Stephen, speaking to some of those complications Whitney listed, it's not just nurses, it's aides, it's right. Kitchen staff, it's sanitation staff. What are the steps to help with these staffing shortages? And what would happen if this COVID supplemental pay stops in March? I know that that's a way that the nursing homes have kind of been helping increase bonuses and helping increase pay. What happens if that goes away?
The provision of nursing home services without that supplemental payment we would lose multiple buildings across the state. Recent cost data from state fiscal year 21. So realize this is now lagging by about 15 months. Our providers who provide nursing home care to Medicaid recipients in the state, the cost of delivering care is about $43.50 above the reimbursement paid by the state of Oklahoma. So that's a $43.50 cliff that exists. The supplemental payments have been filling those at about $38, $39 a day. So it has been extraordinarily beneficial. And I say with full confidence, had the Oklahoma Health Care Authority not made that decision, we would be talking about far more than 5 or 6 buildings. Vaccination rate among nursing home residents in the state hovers at about 85%. Vaccination rate for staff is around 81%. So kudos to our frontline workers, because they have really rallied to make sure that they are providing those protective factors to make sure that the risk of COVID is diminished from the standpoint that we know that vaccination leads to a reduction in the most significant negative outcomes. But it does continue to be present. And one thing I know Whitney has reported on are the very significant federal requirements on long-term care employees related to mandatory masking, mandatory testing, which requires nasal swabs. It has impacted this sector unlike any other healthcare sector.
I want to move into to a question for Kimberly here. We're looking at the severe shortages, but Oklahoma's is far more severe than what other states across the nation are seeing. Why is it such a problem in Oklahoma right now?
Yeah, we like we said before, we've tried everything. I think that we are a very progressive organization, and we're always trying to learn and do things differently. And we may get them in the door initially and think that we're doing good, and then they go to lunch and don't come back. Or we recruit them from hospitals and they say the job is too hard and there's too many regulations, and they leave. We've had more ghosting on interviews than we've ever had in the history of my 30 plus years in the industry. So we're trying to figure that out. And what's scary is by 2030, we'll have all the baby boomers over age 65. That is 1 in 5 people basically that will be retirement age. And if we can't figure this staffing thing out now, the future is pretty bleak.
And I want to affirm Diakonos Group, whom Kimberly works for, really does extraordinary program, and they have been one of the innovators. But I think it's important for the viewers to understand the very basic economics that we're operating under. Nursing homes, about 75 to 80% of the revenue comes from Medicaid. The majority of the balance comes from Medicare, with very, very small private pay. So that's what the payer mix is. And so when it comes to long-term salary strategy, we are dependent upon government purchasers for their reimbursement. Unlike a hospital, we can't go out and negotiate a better rate with a commercial insurance carrier. That's just not in the bandwidth of how long-term care is financed. And so when you look at our reimbursement rate, it is based upon a frontline nurse aide compensation of around $12 an hour. If you look at some of the decisions that retail has made, for example, Target, I believe, is at $18 an hour starting wage for their employees. They are able to fund that because the price of bread and milk has increased. Our providers, Mary's providers, don't have the luxury of setting their rate in the marketplace.
Mary, that's an interesting point that Steve brings up. Have expansions to Medicaid happened? Has there been anything that has been done? I know there was an expansion to Medicaid. Was any of that included?
I go back to what Steve said. We are kind of locked in because of our Medicaid rate. So Medicaid expansion really didn't affect this population. And I kind of want to put this in perspective. First of all, I will say that the direct care staffing is the single most important determinant of quality care in nursing homes. And Oklahoma historically has not had good health outcomes and been ranked low. But let's look at these salaries pre-COVID, $10 to $12 an hour for a nurse aide. And now during COVID, we're seeing that in order to be competitive, we're seeing nurse aide wages of $15 to $19 an hour. But in addition to that, if they don't have enough staff to meet the minimum staffing requirements, they have to go to an agency staff. And that one of my providers that their nurse aides make $15 an hour to $19, depending on their tenure at the organization. They're paying $42 an hour for nurse aides. And that's not sustainable. And at the end of the day, if we're going to care for these individuals in a quality of life manner, we have to have the funds, and that is driven by Medicaid reimbursement.
So Mary, just real quick, you said a state agency has to come in if they don't meet the requirements of a staffing agency. What is that staffing agency? What does that mean when that happens?
Well, that is, a temporary staffing agency. There's several of them throughout the state, and you call, most of them have contracts and say, if we don't have enough staff, we want to be able to call you and have you send in agency staff. But unfortunately, many of the staffing agencies can't even meet that needs themselves.
Whitney, we're running short on time here, so this will be the last question. I know that Oklahoma was just dealing with ARPA funds and trying to delegate where funding is going to go. Do you know if any of that funding was pushed towards nursing home or assisted living or any sort of care for them?
Reese, I'm sorry, I can't answer that question well. I was actually on vacation last week when that was happening, so I'm still playing catch up. One thing I will say, though, about the legislature that I think is really important to mention, you asked, why is Oklahoma worse off than some other states in the country? And while I can't answer that question, as Kimberly said, it's a tough question to answer. What I can say is I've talked to a lot of staff at nursing homes, residents, and, nursing home directors. And what I'm hearing, especially in rural areas, is that the communities that those nursing homes are in are not necessarily helping the nursing homes with their needs. So for instance, I wrote about a nursing home in Alva who was suffering massive losses, terrible COVID outbreaks around the holidays back in 2020. And what they found was the community around them was kind of going about business as usual. They were saying, oh no, COVID is over, you know, we're past it. They weren't masking. A lot of folks were refusing to get the vaccines early on because, you know, they were concerned about what might be in the vaccines. There was a lot of misinformation, and things like that are happening more so in states with very red legislatures like Oklahoma, where, you know, mask mandates are extremely controversial, where, you know, we have a lot of Republicans who are fighting against things like vaccine mandates. And so that's something I'm hearing a lot, especially in rural areas, that, you know, just the general outlook about COVID and the skepticism about whether COVID's actually a problem is really contributing to that burnout and to the way that that these staff and these aides at nursing homes are feeling. You know, they feel kind of beat down, like the job they're doing doesn't matter because they're being told that it's all a hoax, you know, by some residents. So certainly that's not the only thing at play here, but that has been a repeat story that I'm hearing in rural communities.
Well, I'd like to thank everyone for their time. You know, I wish we had more time to talk about this, because clearly this is an issue that, you know, could go on for a long conversation. And I think that conversation is due. So thank you all for your time, and thank you for being here to inform Oklahomans.
Thank you.
Thank you.
Thanks, Reese.